Welcome. My name is David Smith, and I'm the owner of Thriving Family Therapy. The core mission of my practice is to help you and your loved ones go from surviving to thriving. If you've found your way to this channel or to my practice, there's a good chance that you're feeling overwhelmed, stressed, stuck, or maybe burned out. You might be dealing with autism, ADHD, complex trauma, really complicated family or relationship issues, or a combination of several of these. You've probably also gone through a number of previous attempts to get help without really finding anything that works. You are not alone. I promise you, there is a path from surviving to thriving. So, who am I? I'm a licensed clinical social worker offering online therapy in 5 states: California, Oregon, Idaho, Florida, and Vermont. I'm also a clinical supervisor in the state of Oregon. I am an autism spectrum disorder clinical specialist, a certified clinical trauma professional, and a certified family trauma professional. I'm also a certified brain spotting practitioner. I've been a licensed psilocybin facilitator under the Oregon psilocybin program for treatment of complex trauma, treatment resistant depression and anxiety, and other issues. In the past, I've been a school based therapist working primarily out of elementary schools, as well as working in secure psychiatric residential treatment programs and outpatient community mental health. These days, I'm in private practice specializing in neurodiversity-affirming and trauma-informed care, which are my passions. And yes, I myself am a late diagnosed autistic person, as well as what would now be called twice exceptional, both gifted and autistic, although that term did not exist at the time that I was in school. I have personal experience with autism, depression, anxiety, complex trauma, and many of the other issues I work on with my clients. So I'm a fellow traveler, not just an academic expert. I've walked this path myself. Starting when I was about 19 years old, when I went through my first period of what I now recognize as autistic burnout and all the physical, emotional, and mental collapse that comes with that, I've been walking my own healing path. Along the way, I've tried just about every type of therapy and alternative care there is over the past 35 to 40 years. I was diagnosed with autism at age 56, which was last year. That profoundly shifted my self concept and launched a deeper journey of self awareness and personal and professional growth. Ironically, I've been working with neurodivergent people and their families for years before I finally faced the idea that I might be autistic myself. It was my wife, who was also a therapist with 20 years of experience, who first suggested that I might be autistic. And some of my clients were also calling me out. This was years before I went in for the assessment. What can I say? I'm stubborn and sometimes not a very quick learner. So I know how hard it is to find help that actually helps. Along the course of my journey, I've tried just about every kind of therapy there is. Many of those methods were useful and many of the therapists were very good, but for the most part, it just gave me a better idea of why I was having the struggles I was having. Didn't actually change how much I was struggling. So I approached my work through the lens of my own lived experience, not just book learning or what I picked up in grad school. The people I work with are primarily neurodivergent folks. At this point, that's probably about 60 to 80% of my practice at any given time. Many times I'm working with trauma survivors, childhood trauma, complex PTSD, people who have been through various sorts of abuse, people in recovery from domestic violence and narcissistic abuse, various forms of maltreatment, including intergenerational and historical trauma. I often work with parents and caregivers, especially those with neurodivergent children, autism, ADHD, PDA, to help them understand how to parent their children better and make their family life less chaotic and less stressful. I also work with families going through transitions, divorce, separation, co parenting, complicated family situations of various kinds, as well as, of course, people with anxiety, depression, and mood issues. I also have a sideline in helping healers and helpers, such as parents, teachers, caregivers, healthcare workers, who are dealing with burnout and compassion fatigue, including autistic and ADHD burnout. Occasionally work with couples and families who are working through relationship issues and provide family therapy, especially for cross neurotype couples, neurotypical with neurodivergent, ADHD with autism. There are some complicated issues that come up with that, and it helps to work with someone who's actually been through this kind of relationship themselves. Some of my core values include the idea that we can go from surviving to thriving, that it's not enough to just get through the day, it's important to work to find real joy, peace, and fulfillment in life, as well as a sense of purpose. I believe in a saying that comes from Native American tradition that when you heal yourself, you not only heal 7 generations forward, you also heal 7 generations back. Taking charge of your healing is heroic work that requires dedication, courage, and self love, and can also be very challenging. I practice as a fellow traveler rather than some sort of a white coated expert. I walk alongside you, and I aim to provide deep compassion and non judgment at all times. I also believe that change happens in the mess. It happens when we're in crisis. There's an old saying that you should never waste a good crisis because that's when real change is possible. So, what I do is way beyond normal talk therapy. I provide tools for nervous system regulation, stress management, somatic healing, and whole body, mind, and spirit well being rather than just talking about your problems week after week. And along the way, I really try to provide authentic human connection and show up as a real person who has walked this path. This is a safe place where you can fully be yourself. And I try to show up as an authentic human being myself. I am neurodiversity affirming and see autism, ADHD, and other forms of neurodivergence as differences that impact how we interact with and experience life in a neurotypical world that is often very challenging for us. These are not disorders to be cured. I'm also LGBTQ plus allied, and I'm fully committed to the idea of diversity, equity, and inclusion, despite whatever the political atmosphere of the day might say. I believe that by healing ourselves, we heal everyone we touch, and this ripples outward from the work that we do. My work is entirely online and by telehealth across 5 states. This maximizes access, particularly since I live in a rural area in Southern Oregon. Uh, it's much more difficult for people to come to a physical office than it is to come to a telehealth appointment from wherever they feel safe. It also ensures privacy, flexibility, and convenience. I also am big on providing tools that you can use at home, handouts, resources, referrals to other forms of help. Kind of notorious for follow up emails that I give to my clients. And my goal is always to work myself out of a job as quickly as possible. I don't want to be working with people for years and years without making any progress. If you aren't getting better, then I'm not doing a good job. The initial consultation with me is always free. I believe that you need to know you feel safe and comfortable with me before you make a commitment to working with me. I do accept most insurances in Oregon. In other parts of the country, it's largely self pay. So, to recap, you don't have to stay stuck in survival mode. Thriving is possible. Change is possible. I've seen it happen countless times and I've lived it myself. So, whether you're dealing with autism, ADHD, complex trauma, burnout, parenting challenges, or you're just feeling overwhelmed, you deserve support from someone who understands and has been there, who won't pathologize you, who will support you in every aspect of your lived experience mind, body, spirit, relationships, social and sensory environment, all the things. So, my invitation is that I would be honored to share this journey with you. If you would like to reach out, you can visit my website, thrivingfamilytherapy.com, for a free consultation. And I'd encourage you to follow my YouTube channel and my Facebook page, Thriving Family Therapy, and the blog that's on my website for ongoing tips and resources. Feel free to comment on this video. Please give me a like. You're welcome to subscribe. I appreciate your support. Thank you very much, and I hope to see you soon.